That is great. Getting that understanding from the business perspective. I want to move on to Hamza. What do you see is the role of public-private partnership playing the scaling of healthcare innovations, and how does this play into maximizing impact?
Okay, so when we look at those two arms, private and public partnerships, it's like a marriage, right? So you have your wife who is right all the time, and you have you who is not right all the time, right? So there's supposed to be some deficiencies that need to fit in somehow. So when you look at the public sector, the biggest challenge they have is inefficiency. Big. But they have the funding and they have access to the people. When you look at the private sector, the biggest advantage private sectors have is innovation, because you are motivated. The quicker you innovate, the more money you get, the more sustainable you are. But they don't have access, and most private companies don't even have the funding. So I know between me and Jacob, we've come up with so many ideas that we couldn't take to market just because we didn't have the funding, right? So these are two people who would make a very perfect marriage, where the private sector, which has innovative skills and efficiency, would be able to use that to leverage the inefficiencies in the public sector, but then at the same time leveraging the funding and the access these people have to the people. So these public sectors have access to communities. They have access to the hard-to-reach areas. So you can use those things. So public-private partnerships, that is where the gap really comes. That's the ideal situation. You shouldn't have a private company running on its own in a country that has the infrastructure in place already to access the people. It shouldn't be a new learning curve. It shouldn't be a new challenge. It shouldn't be a new barrier. But that being said, when you look at the way public-private partnerships have been working, especially in the space of healthcare technology generally, you do realize that one of the biggest things is capital investment. So the countries that have been very successful in providing those partnerships have been very instrumental in investing into some of these companies. I'll give you some examples. So I worked personally with Apollo Hospitals a long time ago, over 12 years ago, right? And we, in partnership with them, were able to create one of the first telemedicine centers in Ghana. And the only reason why we're able to even think about it was to establish that center is because we partnered with them. But we couldn't grow. We couldn't even expand that service because we don't have the infrastructure to reach the people. Apollo Hospitals, however, has been very successful in expanding that telemedicine infrastructure they have, because they were able to partner with the Indian government through an initiative that is on telemedicine services. So when you have the government supporting the private sector in expanding some of these, the reach is millions of people. So Apollo so far has reached over 170 million people just on their telemedicine platforms, which is huge. We couldn't reach even 100 people because we didn't have the same infrastructure, the same partnership that will give us access to the people. So that's the first thing. That capital investment is very instrumental in that partnership. The second thing is that when we are scaling technology, governments have a role to play. So when you look at the National Health Service scheme in the UK, right? They partnered with Google's DeepMind, and that partnership alone was able to expand how many eye diseases they were able to diagnose across the country. I would doubt and I would argue that if Google had gone into the country on their own to say, hey, we want to do all this screening on our own without the involvement of the NHS, it would have been a different problem, right? So that's the second thing. Scaling is important in that partnership if you want to scale any innovation that you have. The third thing that I want to look at in the space of workforce development, workforce training. So we have people in local settings, especially when we talk about access to healthcare, who do not have the training to use any technology that we are deploying out there. Now, these public partnerships who have access to these people would be able to enable private investors or private companies to be able to give the kind of training they need. So when you look at Kenya, for instance, they partnered with Johnson & Johnson. They were able to, through that partnership, train over 25,000 community health nurses. Without that partnership, I don't know how many people Johnson & Johnson would have been able to reach or work with or deploy that technology to. When we look at the partnership between IBM and Apollo hospitals, they've been able to train thousands and thousands of doctors. Over 10,000 doctors were trained through that partnership. Without that partnership, do we think it will be possible for IBM to even be able to train any doctor in India? And it goes on and on. We can expand this even into supply chain, where we are now looking at vaccines. We are looking at the supply. Most countries have partnered so well with private companies such that they're able to have sustainable ways to keep vaccines viable through the whole cold chain line till they are delivered to the people. But whilst we talk about this, we also have to be cognizant of the fact that there are going to be challenges, obviously, in having these partnerships. As a private investor, if I'm partnering with Jacob to do a job or to launch an innovation, our main aim is to make profit and make a lot of money. When I'm partnering with the government, their main aim is to provide access, reach people, look good in front of the people, and be able to get grace when they need it from the people, right? So they are looking at this from an accessibility standpoint. We want the accessibility, but we are also looking at it from a profitability standpoint. So we may come up with a pricing that is moving towards profitability, and the government might be coming from an area where they are trying to make it accessible. That's where the friction might happen. We also have to look at, when you're doing those partnerships, so you need to be very clear on who owns the data. The fact that I'm partnering with you doesn't mean we both have the same level of ownership to the data. So in building out that partnership, that has to be very clear on who owns that data, and then it prevents any ripple effects of whatever could have come out of that. And the last thing is that sustainability, because if you build a partnership based on a non-sustainable funding source, where you are very reliant on the government to fund every single activity, but without the entity itself having the ability to generate its own income, then that's going to be a challenge. Because what would happen is that the moment that government changes, and we all know how the political terrain works in Africa, once that changes and the next government decides that they don't want to do any business with you, are the people going to lack that service just because you didn't have a sustainable model to keep it going? So those are some of the things that you should think about when you're looking at it. But overall, it's a perfect marriage that needs to happen in every area, especially in areas where healthcare accessibility is a problem, because it makes it easy to get the investment to build the infrastructure needed. It makes it easy to deploy any technology that you want to put in there. It makes it easy to train the people who use the technology that would help the people. It makes it easy in so many ways, but also be cognizant of all the challenges that would come out of it.